Howdy, folks. I'm Doc MB, your host of Healthy Humor, and with me today is Dr. Kyle Craig, optometrist. He's also my family's optometrist. If this was live, I'd say let's do a round of applause, but it's not live, so yeah. So what got you excited about optometry? Like, where did the passion to become an optometrist come from?
Well, I mean, for me, it came back when I was a kid,
Okay.
and I got my first pair of glasses.
How old were you?
Oh, nine or 10.
Okay.
I mean, I was starting to get sick in school.
Mm-hmm.
Like every couple of weeks, I'd have to go home, and my stomach would hurt, or I'd have a headache or something. And
Okay.
half through the day, I'd go home, and my dad we went to this doctor, that doctor. They're like, everything's fine.
Yeah.
My dad was like, are you going to the bathroom? Are you eating food? Are you
Mm-hmm.
drinking water? So finally, they took me to an eye doctor, who's one of my parents' friends at the
Mm-hmm.
time, and I couldn't see when I was nearsighted. I mean, I couldn't see clearly far away.
Okay.
And that's why I was getting sick.
Mm-hmm.
And for me at that point in my life, baseball was all I really cared about.
Yeah.
And I couldn't see to hit a ball anymore.
Okay.
So I got from being able to play in every game to having to sit the bench.
Yeah.
And got glasses, and I'm like, I can see the ball again, and so it all came back. And
Right.
my mom tells a story that after I got my first pair of glasses, and I told her that I was going to be an eye doctor. I don't remember it. I don't know if she's just making it up,
Uh-huh.
but that's the story that she tells, and she'll be like, "No, you were in the car and you told me this is what you were going to do."
Oh my
So
Yeah.
so I got it at an early age, and then it just kind of interested me. I kind of
Mm-hmm.
always thought being a doctor would be fun, taking
Yeah.
care of people and doing that sort of stuff. And I guess the eye stuff just kind of stuck
Mm-hmm.
because it had a kind of that personal connection to me. So
Yeah.
yeah.
Yeah. I hear all the time when people tell about the first time they got glasses, and it's they put them on. It's like, wow, I didn't realize trees had leaves because it was just a blur.
Yep.
And,
100%. I said the same thing. So I grew up in Enid, and where we lived was on the far west side of town, and it's flat, so you can see forever.
Okay.
So
Out here, Fairview.
the far west side of Enid itself.
Okay.
So like the bus would come down the road, and you could see it 3/4 of a mile away. And I go, Mom, there's a bus coming down the road. She goes, yeah, Kyle, it comes down the road every day to pick you guys up. I go, well, I can see it now. So I could never see it before.
Yeah.
So it's just stuff like that. But the leaves on the trees is always the biggest one. And having the view of it out here with kids, I'll bring them out and put lenses in front of them. They're like, oh my gosh. They just light up and they smile, and they're like, oh wow, I can't believe that's what it's supposed to look like.
Right.
Because when you're nearsighted as a kid, you don't know anything's wrong.
Mm-hmm.
They don't complain about it.
Yeah.
They don't tell mom or dad, I can't see far away. They just
they don't
think that
know.
that's how it's supposed to be.
Yeah.
Until you show it to them,
Mm-hmm.
they're like, oh wow, there's a whole world out there.
Right.
Because otherwise, everything's right here. Everything's up close.
And that's kind of crazy to me, just because we were talking about this earlier. Like with little kids, everything is so new, and they want to go and they want to explore, and their world should be the world.
Yeah.
But if they can't see it, it's just this.
Yep. Yeah. Keeps them more, introverted and stuff like that. And that kids, you just see them, they just light up. They're like, wow, look at that stuff.
Yeah.
It's just crazy. So that's a fun job.
So what did the path from young Kyle, I can see now, Mom was telling everyone I want to be an optometrist, to actually becoming an optometrist? What was that path?
Yeah, so, when, after graduating from high school, I mean, one class I took in high school was an anatomy and physiology class. And it was really interesting to me, obviously. So that sparked it. And then went to Oklahoma State, and ended up having a physiology degree, and did all the pre-med route and all that sort of stuff. And at that point, I kind of was like, well, maybe I'll go to medical school and look at the ophthalmology side of this.
Real quick for listeners.
Yep.
ophthalmology.
Yep.
How does that differ from ophthalmology?
So ophthalmology goes to 4 years of medical school.
Okay.
And then typically they do somewhere between a 4 and a 6 year residency after that, depending on what type of specialty they go into. To whereas for optometry, we go to 4 years of optometry school.
Okay.
So, in med school, it's 4 years of full body. We do about a year of full body, and then everything goes straight to eyes.
Okay.
Yeah. So college at Oklahoma State. And then I thought about doing ophthalmology and took the MCAT a couple of times, and I couldn't pass the reading portion of the MCAT.
Still couldn't see.
Yeah, no, it wasn't because I couldn't see it. It just didn't compute, So one of my buddies was like, "If you want to do eyes anyways, why don't you just take the optometry test?" And that was more. I don't know if it was easier or the way the questions were written. I scored better on that, and I'm like, "Well, this will work," So, let's see, I applied to 3 or 4 different optometry colleges. Went to Memphis first, interviewed there, got accepted, and then interviewed at Tahlequah at NSU, College of Optometry, got accepted there, and it's in-state, more feasible in terms of student loan debt,
right.
And closer to home. So we went to Tahlequah and went there for 4 years. Graduated and kind of opened this up and started from there.
Yeah.
So, yeah.
Love that. So you are an optometrist, but as I've seen, you're also good at some relatively emergency eye care.
Yeah.
With my recent eye injury.
Yep.
But I know that you also do other things. You see patients for things like glaucoma.
Yep.
Macular degeneration and other eye injuries besides just Nerf bullets.
Right. Yes.
So, is that part of normal optometry schooling,
It
or
is.
is that okay?
Yeah. So a lot of times we kind of get the perception of all we do is glasses and contacts.
Okay.
Okay. I mean, yes, that's a huge part
Mm-hmm.
of what we do. But yeah, I mean, we're trained and taught how to diagnose and treat glaucoma and macular degeneration and cataracts and red eyes or if you get a scratch on your cornea or a piece of metal in your eye or you get hit with something, that's all part of normal optometry training. Okay. Now, depending on where you live and where you practice, some may be more medically based to where you're treating more disease-based patients with, diabetes or hypertension and that sort of stuff. And you may not do as much glasses and contacts just because that's what your patient base requires. But yeah, that's all part of normal optometry training that we get in the 4 years, of schooling. There are residency programs in optometry. Those are typically a 1 year postgraduate, I guess, extra year of schooling. It's sometimes they're done at colleges of optometry, but a lot of times they're also done at residency program sites. Okay. And for those, you have like vision therapy is one that you can do. You can do them in primary care, like what I do. They actually have residency programs for that as well. Then they have them for more of like your referral based offices that work with ophthalmology and optometry, to where they don't really do glasses or contacts at all. But it's like if I have a patient that needs to have surgery or needs to have, if something's getting to the point that I don't feel comfortable taking care of them or treating them anymore, and I got to refer them on, that's where those type of optometrists practice at. Typically. So yeah.
So with a lot of health, people don't know when to go. And I saw this very recently within my own extended family. We recently got Warren in to see you because he hadn't had his eyes checked, in decades.
Yep.
And coming from a family of a lot of glasses wearers
Yep.
on both my side and then also on his side, my thought was go get them checked anyway, even though you don't think you're having problems, go get them checked.
Yep.
Is there a rule of, if you aren't having issues, if you aren't having headaches or, difficulty seeing the school bus or whatever, how often should we be getting our eyes checked?
I mean, we should get them checked every year.
Okay.
An annual eye exam. I mean, because it's the thing with the eyes is, again, what brings most people in is they can't see.
Okay.
For those of us that are fortunate enough to have good vision, for the majority of their life, a lot of times we may not see them until they're 45 and they start to lose their ability to see up close or read, and they're like, I mean, it happens more often than you think. It's like, I haven't ever been to the eye doctor before. And I'm like, you're 45 years old.
How have you never been to the eye doctor?
What would you not, it's like, what, would you not go to the dentist for 45 years?
Right.
So, but no, I mean, annually is important, mainly to check the health of the eyes.
Okay.
Even if you don't have a vision problem, at least to make sure we're not dealing with a cataract or developing glaucoma. Because a lot of the stuff with your eyes, it is a very slowly progressing process to where you don't notice that there's a problem until it's too far gone.
Yeah.
And a lot of stuff with eyes is once you lose it, getting it back is very difficult to do. Now, this is outside of glasses and contacts and that sort of stuff.
Right. That's more like with injury.
Injury or just a general aging process disease like glaucoma or macular degeneration. But even for like kids, so there's a program called Infancy to where we do eye exams on kiddos under the age of 12 months. That's a free exam.
Okay.
There's people ask, well, how do you check the eyes of a 10-month-old? Not the same as we do for a 25.
Right, they can't go set their eye or their chin on the thing.
At that point, we're just making sure that their eyes are looking the same direction. That the eye can track properly, that the pupil's functioning, that we can see the back of the eye. I mean, we're not very rarely we're prescribing glasses for someone that young. And if they need glasses, I'm going to refer them on to typically a pediatric ophthalmologist for them to take care of a little kiddo.
Right.
But so that's what's suggested is, at about a year or before a year. And then we can go every other year. So 1, 3, 5. And then when they get into school, it's recommended that we check them every year.
Yeah.
Yep.
Because I know that whenever I got glasses in high school, I was having issues seeing the board. And I can only imagine if someone's got a prolonged, several years of I can't see the board clearly, what information they're not then getting.
Not attaining. Yeah.
Yeah.
And that's, I mean, it's kind of like whenever I got my first pair of glasses. I remember my mom being like, "Come on, Kyle, read the letters. You can see that." And the eye doctor was looking at my mom like, "No, he can't see that." And that's the thing that parents will get visibly upset. That their kid can't see.
Right.
And they're like, God, am I being a bad mom or a bad dad for not getting my kid in earlier than this? And I'm like, it's fine. We'll get them fixed up. They'll be just okay.
Yeah.
So.
But if they're not telling you that there's a problem, how are you supposed to know that
Yeah,
they can't see that?
Yeah. And that's why it's before school starts, on a yearly basis, we need to see kids.
Yeah.
Or if they're having issues, a couple of weeks or a month or two into school that may be new, we need to see them.
Right.
Because that's the biggest thing anymore is kids do so much more work up close. It's
and with screens,
the reading, it's the iPads, it's the computer screens, and that's causes muscular fatigue. And now those kids may have great vision far away, but they're straining to see up close.
Yeah.
So it's they get headaches, they get fatigue, they start skipping lines when they're reading, or the image comes in and out of focus on them. And it's just those go undiagnosed a lot. But that was never really a problem when we were kids because we didn't do enough near work to cause cause the fatigue to set in.
Okay.
But we see that a whole lot more now with kids, and that's why you look when people take their kids to school, they're like, oh, there's a lot of kids wearing glasses.
Yeah.
A lot more than what there ever was before,
Mm.
and a lot of it's because of that.
Okay.
Just because, and a lot of kids will grow out of that
Yeah.
as they get bigger and stronger, and the muscles get built up. A lot of times they can kind of go out of the reading glasses, when they're little.
Yeah.
But yeah, that's kind of what we see there.
Yeah.
So.
When you have patients come in, I'm sure they ask you all kinds of questions.
Mm.
What are some really common questions that you get?
Oh, I mean, a lot of them, with older patients, it's about cataracts,
Okay.
and
Mm-hmm.
it's about, do I have glaucoma? My mom has macular degeneration, or my
Mm-hmm.
uncle has glaucoma. It's,
Yeah.
they're wanting to look at making sure they're healthy, and what can I do to prevent some of these things from happening, and but yeah, I mean, a lot of times it's little stuff,
Mm-hmm.
it's I got this yellow looking thing on the white part of my eye,
Yeah.
I just noticed it, and I'm like, yeah, it's called a pinguecula. It's scar tissue from being outside in the sun,
Okay.
and we don't really need to do anything about it,
Mm-hmm.
but it's there, and yes, you saw it, but nothing to worry about,
Okay.
and for the people like myself, for us nearsighted individuals, it's
Mm-hmm.
like, well, how much worse did it get? How much stronger do my glasses or contacts need to be?
Right.
That's a lot of what we get. So,
Okay.
yep.
Are there any questions that you get and you're just like, where did that?
Oh yeah,
Come from.
yeah,
You know.
yeah. The kids always ask the funniest questions,
Oh yeah.
and I mean it'll have nothing to do with their eyes.
Mm-hmm.
And I'm like, well, I'm not the expert to ask that.
Yeah.
I can give you an idea, but I
Uh-huh.
don't really know.
Okay.
So, but no, that's the questions are always funny to hear
Mm-hmm.
from when the kids ask. So.
Yeah.
Is what's your like on a day-to-day basis? What's the best part for you? Is it you got someone glasses for the first time and they can see the leaves, or is it you found out someone's got glaucoma and their quality of life's gonna improve because they're gonna.
Yeah, I mean, really, the part of this that I probably enjoy the most, honestly, probably doesn't even have a whole lot to do with being a doctor.
Okay.
It's just getting to hang out and talk to people.
Yeah.
I mean, that's probably where I get the most enjoyment of it. And
Mm-hmm.
that's what I do. And the doctor side of it, obviously, that's very important.
Mm-hmm.
We have to go to school. We have to have the training. You
Right.
have to have the knowledge. You have to know how to manage the different diseases and things that we see on a daily basis.
Mm-hmm.
But I mean, that's kind of like hit the autoplay button,
Yeah.
and the response just comes out of my mouth.
Right.
This is what we need to do for this and this and this. But
Yeah.
really, I just enjoy talking to people.
Yeah.
Listening to them, finding out, you know, where they're from, what their history is, and which sometimes causes me to get behind on a daily basis with appointments, and my staff's like, "Come on, get on out of the room, stop
Yeah.
talking, let's go." But
I've seen them kick you a few times.
yeah, but that's, I mean, that's probably just me, but
Mm-hmm.
that's the part that I like. I just like talking and communicating with people, and
Yeah.
we with the doing the eye doctor stuff is fun, and I enjoy it.
Right.
But yeah, I mean, it's really it's trying to find one aspect in maybe not every patient, because you can't find it in every patient,
Mm-hmm.
but what's one thing that we can do, or I can suggest, or I can recommend, that will improve their quality of life
Yeah.
a little bit.
Mm-hmm.
Whether it's, okay, here's some glasses to drive at night, or it's,
Yeah.
hey, you need to make sure and clean around your fake eyelashes so you
Uh.
don't get a sty, or it
Right.
doesn't cause dry eye,
Uh-huh.
or it's like, hey, you can't put your eyeliner right on top of the tissue here because you're blocking all your oil glands.
Okay.
Whether
Yeah.
they even have a problem with it or not, or are complaining of it, it's like,
Right.
get it a little bit lower so it's not going to cause a problem in 20 years down the road.
Right.
Because that's the other thing is, I mean, my job is to keep you seeing
Mm-hmm.
for as long as you're alive.
Okay.
You know,
Yeah.
that's kind of the way that I look at it is, and if I can give you, if you don't have a vision problem, but we're doing something else that may cause a problem when you're 80,
Mm-hmm.
not when you're 25, but eventually it's here, here's this little pearl,
Mm-hmm.
do this instead of that,
Right.
and it's not even that they're having problems with it, but it's at least it kind of can set that mindset of what they can do on a daily basis just to improve their eye health. So,
Yeah. Give them a little autonomy over
yep,
that for
yep,
sure.
yep, yep.
I have to ask because for my students and
Mm-hmm.
anyone out there listening that maybe isn't my current student
Right.
that's interested in going into optometry,
Yeah.
what's your advice or you should probably do this, or if you're interested,
The biggest thing that I didn't do
Mm-hmm.
until probably really I was already in school
Mm-hmm.
is I didn't go shadow anybody.
Okay.
I mean, I did some. I actually was a phlebotomist
Oh, okay.
for on and off in between school breaks and things like that,
Mm-hmm.
and that helped a lot just dealing with how to talk to patients and how to
Yeah.
communicate with them. And
Mm-hmm.
it was in an oncology clinic, so I got to deal with people that were sick, a
Mm-hmm.
fair amount. So it kind of helped the conversational skills,
Yeah.
of kind of how to navigate when they're not feeling very well, or how
Right.
to navigate when they're in a great mood and they're not sick from their medication.
Mm-hmm.
But that's the biggest thing for me is I would go shadow
Mm-hmm.
an optometrist,
Okay.
or like I had a student here recently that came and shadowed me for a couple of days in the clinic,
Yeah.
and I'm like, shoot, ask any question you want,
Yeah.
just fire away, and I can kind of help guide you in terms of different aspects of what the next steps are, but
Mm-hmm.
it's going and whether it's your current eye doctor,
Yeah.
you know, ask them, hey, I'm interested in this. Can I just follow you around for a day just to kind of see what your daily habits are and what's the work look like and that sort of thing. Because when patients come in here, they're in the chairs, they're behind the phoropter, they're behind the slit lamp. They don't get to see a lot of how the other stuff works.
Right.
And quite frankly, most of the time when people are in here, they can't see anyways because we take their glasses off or we take their contact lenses out, and I'm like a blur to them anyways. So they don't. If you really want to get into it, that would be my biggest thing is shadow someone. If you have time on a summer, go and work. Get a summer job. Checking people in. That way you kind of just get an idea of how it all works with insurance side of it, and you can find out, do I really want to deal with the public on a daily basis? Because that's what we do all day long. But it's and then it's having the right, kind of pathway and talking to your counselors in high school or in college. What classes do I need to take? What does my path need to be?
Right.
And those sorts of things. So, yeah.
Yeah. Is there anything that we didn't go over that you kind of just wanted to share?
I think we kind of
Covered
I think we covered a lot of it.
Yeah.
I'm sure there is. But yeah, I mean, it's the biggest thing that this is what I told the student that was here. I'm like, one, and this doesn't matter what you do, but do something that you enjoy.
Yeah.
Do something that, gives you some gratification, on a daily or weekly basis. And if optometry is what it is, then we get to do a lot of cool things. We get to help people see better.
Yeah.
We get to help them, continue to do the things they like to do. If it's, hey, I can't see the end of the pool table and I like to shoot pool, okay, I can make you a pair of glasses for that.
Yeah.
Or it's, I wanna be able to see the golf ball when I hit it 300 yards down the fairway. Okay, we can help with that. So that's the other side is there's a lot of, we can go down a rabbit hole how far we want to go if you want to see something very specific.
Right.
You know, it's like for people who shoot guns, you know, for competition, shooting and things like that. I mean, there's, you know, if you ever see like the Olympics and they got these weird
Yeah.
glasses on, I mean, those have special lenses to help them see the end of the sight plus their target, you know. So, I mean, we get to do lots of stuff, and it's just a wide, the areas of optometry that you can go into are very, very vast.
Okay.
You know, it's not what I do is what most of us do, you know, but it's not what everybody does.
Right.
You know? So I think it's just find something that you enjoy to do. And if you love doing it,
Never work a day in your life.
do as much of it as you can. So, yeah.
Love that. Well, thank you.
Yeah, welcome. Thanks for having me.
Well, I hope everyone has enjoyed this and go out and have a happy and healthy day.